If I'm someone who aspires to be in defense forces, can refractive technology help me looking at what my further life's going to be?
Absolutely. I think this is one of the big boon that sometimes patients tell us, that you've actually allowed us to live our dreams.
Right.
So refractive surgery within certain limits of eligibility criteria laid down by the government can be done for candidates. The candidate should be above the age of 20 and the power that you can correct has to be less than -6. So if your power is very high, then refractive surgery, even if you get it done and if your vision is fine, but because you've gotten a higher power corrected, you may be disqualified. What causes a power to be high is that your eyeball is larger, right? So like you measure the power, you can measure the size of the eyeball also. So if it is more than 25.5 mm, you cannot apply for the army. 25.5 is actually the Navy and the Air Force, and 26 is the Army and Police. So roughly, if you are less than 25.5 mm in terms of eyeball size, which can easily be measured by your doctor, your power that is corrected is less than -6 diopters, you will be a safe candidate for getting it done and still getting enrolled. After the refractive surgery is done, sometimes people say that the outcome may still, if you have a 0.5 power left behind, you still don't need to worry, because the army will still enroll you if your power is within ±1 diopter. However, the cornea, we work on the cornea to reshape it. The cornea becomes thinner, because whenever we're going to reshape something, we're going to remove tissue. A normal cornea is between 550 to 500 microns. So after the surgery, your corneal thickness should be more than 450 microns. So these are the basic criteria, but your doctor will be able to tell you pre-operatively if you check off these criteria. Broadly, what you should know is, yes, refractive surgery makes it safe and makes it possible for you to enter the armed forces, provided your power correction is less than -6 diopters and you get it done after the age of 20 years.
Follow Planet Lasik and post your queries to get answers from the experts.